Assalamu alaikum. I'm Dr. Muhammad Ali Rabbani, and today we are going to discuss the first lecture of general anatomy, that is the introduction and terms of anatomical nomenclature. And I will be focusing majorly on the terms of position and movement that are encountered in the subject of anatomy. To give you a brief idea of how this language looks like, I will give you an anecdote. I will give you a little story. You can pause the video here and try to read it. I hope you have read it by now. You can unpause the video and how many words did you know? You can mention it below in the comments. But let's go on with the lecture, and we will try to cover all of these topics, and by the end you can try to read it again. Let us move on. Your focus is, by the end of this lecture you should be able to define anatomy, enumerate the branches of this subject. Then we will talk about the anatomical position, what are the different planes, and then we will go on to discuss the terms that are related to position, terms that are related to movements. Anatomy. As you all know, anatomy, literal meaning is anatomos, means to cut up. So it is basically this. It comes from the Greek word cut up. It's basically talking about the dissection. So while we're talking about the science, it's not only confined to the structure. Anything, any science that is related to study of the structure, it can be from the gross to micro level, that is constituting of anatomy. And uh, in the medical college, you will be chiefly concerned with the anatomy of the human beings, but the word anatomy refers to all the living organisms. Branches. Gross anatomy. Gross anatomy is the study of the living organisms, the things that are visible to the naked eye. You know, you have a nose, you have eyes, you have ears, what you can see visually, what you can see from the surface, what you can see when you open up the body and look inside after dissecting, what you can see with your visible naked eye, that is the gross anatomy. Histology, also known as microanatomy. As the name indicates, it's the study of fine body structure details with help of microscopy, the structures that are too small to be seen with the naked eye, we study in histology. Then comes the embryology. Embryology is the study of all the processes through which gametes join to form zygote, then cells, tissues, organ, and the whole body as form. So all the processes from the fertilization all the way till birth. Then there is another word, that is developmental embryology, developmental anatomy, that encompasses a wider range of topics, including embryology and moving on to the child growth as it grows to be an adult. So the developmental anatomy, it encompasses a wider range, but we will be focusing majorly on embryology in your medical college. While talking about gross anatomy, you will find out there are different approaches toward teaching it. A lot of colleges, a lot of institutes, including ours, have a regional anatomy approach. We divide the body into different regions of upper limb, head, neck, thorax, abdomen, and then we go from region to the next region. Systematic approach goes by the systems. Like, you start the skeletal system and complete it from one end to another end. Then you start the muscular system, then you start the cardiovascular system, and so on. Clinically applied anatomy, it's basically the study of the clinical relevance of the basic concepts of the anatomy to the practice. Let us start. This is an visual representation of the regional anatomy, which regions can be divided into like head, neck, thorax, abdomen, pelvis, perineum, upper limb, lower limb. So these will be the regions you will be following throughout your first 2 years of medical college when you are going to study anatomy. In the first year, you will be reading about upper limb, lower limb, and thorax, and then the rest will be covered in the second year. Let us come to the topic of nomenclature. Start with anatomical position. In anatomy, you will have to constantly refer to the position of one organ with respect to the other. This organ is superior to this. This is placed anteriorly. Foot is placed superiorly. Foot inferiorly. So there will be a lot of uh, relations and positions of the organs of the body parts discussed. If you don't make a standard anatomical position, a person who is witnessing something on a patient who is lying down may describe it differently as compared to a person who is witnessing it on a person standing up. So to keep the things uniform, anatomical position is standardized. This is a visual representation. It's the position you consider that a person is standing erect. The arms are by the side. Palms of the hand are facing forward. Feet are close together with toes pointing forward, head straight, and eyes looking to the horizon. So, whenever you're talking about any placement, position, or movement of the body, this is the 0 point you will be starting from. This is the reference point from which you will discuss the terms of position and movement. This is the anatomical position. It does not matter if the person is standing upside down. In terms of anatomical nomenclature, head will be superior to the neck, no matter if the person is standing erect or standing upside down. So, anatomical planes. To describe position of the body, we divide the body into various planes. Let's go to them one by one. Median plane, median plane, mid sagittal plane. Mid sagittal plane is simply the plane that is running from anterior to posterior, goes through the midline, and divide your body into two halves. So this one is the median plane. This one, it moving from vertical plane, longitudinal plane that is moving from anterior to posterior and dividing the body into two equal right and left halves. This is median plane and mid sagittal plane also. Then there is paramedian plane or sagittal plane. The name may give away its answer already. It's any plane that is parallel to the median plane, that is known as paramedian plane, parallel to the median plane. So the plane in the midline is mid-sagittal plane. Any plane, this plane, this plane, this plane, this plane, all the rest of the planes will be paramedian planes. And these will be dividing the body into unequal right and left half because it depends upon the position of the plane you are placing. So these are median plane in the midline, paramedian plane away from the midline but parallel to the median plane. Alternate names are mid-sagittal plane and sagittal plane respectively. Then comes the coronal plane, frontal plane. It's the plane like this. The plane moving side to side and it's vertical and it divides the body into anterior and posterior parts, and you can see that it is at right angle to the sagittal plane. Uh, it's very understandable due to the lack of symmetry in this region. It does not have any midpoint because anterior part of the body is different from the posterior part of the body. There is no mid sagittal equivalent plane, so it will always be unequal, divides body into anterior and posterior parts. Then is transverse and horizontal plane. There are multiple names for it: transverse plane, axial plane, transaxial plane, horizontal plane. All of the names are indicating the same plane. So this plane is horizontally placed parallel to the ground, and it will be at right angles to both sagittal plane and coronal planes. So this is the transverse plane or axial plane. When you are looking inside the body, you will find pictures in the atlases drawn in various sections. When your sections like sagittal section is placed, the picture will be mentioning that this is an image of thorax in sagittal plane at the level of um, at the level of pyloric of stomach. So like this is the horizontal plane played at the level of third thoracic vertebra, and so on. It will they can be different planes, and same will be different sections, different planes will be used in the CT scan, in the MRI, and these radiological images. So this section through the plane, they can be of different types. There is another word that is longitudinal section. So there were two planes that were present vertically. There was sagittal plane that was anteroposteriorly and above downwards. So it was standing vertically. There was coronal plane. This is the sagittal plane. The coronal or frontal plane, it was going from right to left, but it was going from above downwards also. So any plane that is going from above downwards, including sagittal plane, including frontal plane, or any plane in between them. So all of these will be longitudinal sections. They should pass through midline, they should pass through vertical axis. They can be sagittal, they can be coronal, and they can be anything between them. Horizontal section. Names give it away. Section in the transverse plane. Like this is the transverse section, horizontal section in the mid of the arm. This is the transverse section in the thorax. These are the lungs and these are the great vessels. So these are transverse sections. This can be at any level along the vertical axis. And then there is a combination. You don't have a pure horizontal section, you don't have a pure sagittal section, you have a mixture of these two. Some structures are visualized better in such a way. So any combination of horizontal or any longitudinal plane, this will be an oblique section. Like to visualize the stomach, it is easier to have an oblique section rather than the coronal or pure frontal and other sections. Now, to the next part of the lecture, terms of positions. These are the terms of position that require you to visualize the body in the anatomical position. These are present in pairs like superior and inferior position, anterior versus posterior, medial versus lateral, palmar versus dorsal position. The name gives them give lot of them away, but let's look at them here. Let's go from superior versus inferior. It's self-explanatory. In the anatomical position, as you move towards the head, you're talking about superior. So, nose is placed superiorly to the lips. Lips are placed inferiorly to the nose. Nose is placed inferiorly to the eyes. Eyes are placed inferiorly to the forehead. So, with respect this structure, when comparing two structures in a longitudinal plane, superior and inferior helps you. Alternate names for superior and inferior are cephalic and caudal, means Cephalic means near the brain, caudal means near the tail, and cranial again another name for the skull vault and brain. So there is superior and inferior. Then comes the anterior and posterior. Again, self-explanatory. As you move in the horizontal plane, as you move towards the front, you are moving anteriorly. As you move towards the back, you are moving posteriorly. So the nose is anterior to the ears. The chest is anterior to the back. Ears are posterior to the nose. In the foot, the toes are anterior to the heels. The heels are posterior to the toes. So this is anterior versus posterior. Alternate terms used for the anterior versus posterior are ventral and dorsal. Take note of this point because this is the term used more frequently in the anatomy textbooks while talking about towards the anterior, while talking about towards the tummy, you're usually using the word ventral. So my rib cage is placed, my sternum, this bone is placed ventral to my heart. Sternum is placed ventral to the vertebral column. So this is anterior versus posterior. And that leaves us with medial versus lateral. We can see medial versus lateral are movements along coronal plane as you move towards the midline, as you move towards the median or sagittal plane, this is medial. As you move away from the midline, this is lateral. Let us again go through the example of structures of the head and neck. Nose is placed medial as compared to the eyes. Eyes are placed lateral as compared to the nose. Eyes are placed medial as compared to the ears. Ears are placed lateral as compared to the eyes. Thumb is placed lateral as compared to the little finger. Big toe is placed medial as compared to the little finger. So these are the movements, these are the position across coronal plane. Towards the midline is the medial, away from the midline is the lateral. Now we come to the last pair, that is palmar or plantar versus dorsal. In humans especially, the upper limbs, these are very mobile structure. Before studying the anatomy, you might even think that the neutral position of hand is somewhat like this and or like this while using a keyboard or writing a pen. So immediately to visualize the hand in the anatomical position may be troublesome for some persons. So to make things simpler, to relieve yourself of the anatomical position, while talking about the structures of the hand, you simply say if it is towards the palm, it is palmar. If it is towards the back, it is dorsal. If you think of it in the anatomical position, palmar is basically ventral and dorsal is basically dorsal. Excuse me. So to make things simple, towards the palm is palmar, towards the back is dorsal. So your fingerprints are placed on the palmar aspect of your hands. Your nails are placed on dorsal aspect of your hands. And that from this you might have already guessed about the positions in the foot. Towards the sole of the foot will be the plantar aspect. Towards the superior aspect, towards the dorsal, this is the dorsum of the foot. You see how it may create confusion because when talking about the hand, it may be anterior and posterior. While talking about the foot, it may be inferior versus superior. So to get out of your confusion, while talking about hand, you say plantar versus palmar versus dorsum. While talking about the foot, you say plantar versus dorsum. So these are the terms of position when you talk about in the anatomical position. In the longitudinal plane, in the frontal or coronal plane, or sagittal plane, move superiorly, superior cephalic cranial, inferiorly, inferior caudal. In the sagittal plane, if you move anteriorly, that will be anterior. If you move posteriorly, that will be posterior. Alternate names are ventral and dorsal. In the coronal plane, away from the midline will be lateral, towards the midline will be medial. In the hand, towards the palm will be palmar, towards the back will be dorsum. In the foot, towards the sole will be plantar, towards the back will be dorsum. So these are the comparison of anatomical positions. A combination of these terms can be used. Any combination can be used. Anterolateral, anterosuperior, supralateral. For example, if you give a relation of eye to the nose, eyes are placed suprolateral to the tip of the nose. Ears are placed posterolateral to the eyes. So a combination of the terms can be used. You can make any combination out of these pairs. Then there come the terms that do not depend upon the anatomical position. First, there is this set of these three: superficial, intermediate, deep. Whenever the structure is near the surface, it is called superficial. Whenever the structure is towards the depth, that is called deep. Towards the skin is superficial, towards the bone is deep. So bone is superficial, bone is deep, and skin is superficial. And anything between them will be intermediate. So muscles are intermediate, bones are deep, skin is superficial. And these terms are again relative to each other. For example, here you can feel the sternum bone right here. It is relatively placed superficial in the body, but with respect to the skin, it is deep, skin is superficial. With respect to the heart, sternum bone is superficial and heart is deep. Similar terms are used for the external and internal, inside the body, outside the body, inside the organ, outside the organ, internal aspect of the stomach, external aspect of the stomach. Then there is the word proximal versus distal. Proximal versus distal is usually used in the limbs, and when you talk about the towards the center of the body, towards the point of attachment. So your fingers are the most distal structure of your limbs. Your shoulder is the most proximal structure of the limbs. With respect to the elbow, shoulder is placed proximally. With respect to the wrist, elbow is placed proximally. With respect to the wrist, fingers are placed distally. So the same can be used for the lower limb. As you move away, you are moving distally. As you move back, you are moving proximally. So this brings us to most of the terms of position. Now, these terms of laterality, these are used when you are talking about usually more than one things in comparison. These terms are unilateral, bilateral, ipsilateral, contralateral. If something is present only on one side of the body, any event, any place is present on one side, that is called unilateral. For example, appendix is present unilaterally on the right side. That can be used to describe an event also. I am feeling pain in the leg unilaterally. I am feeling pain only in one leg also. Only one leg. When the event, when the structure, when anything you're talking about is happening on the two sides of the body simultaneously, then it is bilaterally. Legs are present bilaterally. I am feeling pain in both of my legs. I am feeling bilateral pain. This patient is feeling weakness in both of the limbs, both of the right and left legs. He is having bilateral weakness of the lower limbs. So bilateral means anything that is happening simultaneously on both sides of the body. Then comes ipsilateral. When we talk about the second thing with respect to the first thing, and then we say if it's on the same side or not. If a person comes to the stroke and has the pain, weakness of the right limb and right lower limb, right upper limb and right limb. He is having weakness of the right upper limb and the ipsilateral So ipsilateral is on the same side. Contralateral, any event that is happening on the opposite side of the body. For example, even I'm wearing this, I have my phone right here and my purse right here. So I say I have my phone on my left pocket and I have my wallet on the contralateral side. This person is having pain in the left arm and having pain in the contralateral leg. So with respect to the other thing, if it's on the other side, you use the word contralateral. Terms of movements. This is our next section. If the body is not static, it's moving, then what exactly the movement is, this is described by the terms of movement. So these are the terms flexion, extension. Whenever, usually, it's usually whenever you decrease the angle between the bones, like these two bones, the angle has been decreased. This is bending forward, decreasing the angle, folding. This is flexion. I'm flexing my fingers at this elbow angle. If I fold it like this will be flexing the elbow. And opposite of at wrist joint, moving it forward like this will be flexing the wrist joint. The difficulty comes a little when talking about shoulder joint. It does not decrease the angle as per se, but as you move the arm anteriorly, this is the flexion. Move it back, that is the extension. So bending forward, folding and decreasing the angle will be considered as flexion. Bending backwards, straightening, increasing the angle will be extension. Flexion extension, when talking about the foot, it's a little tricky because when you I can show you the picture in the next slide. Yes, when you stand on your toes at the ankle joint, technically speaking, it is flexion. So it is very confusing. You have anatomical reasons for that. I'm not going into the detail right now. And moving it up while you are standing on the heels, this is extension. It negates your formula of increasing or decreasing the angle. To avoid the confusion, you use the words dorsiflexion and plantar flexion. If you're standing on your toes, moving the foot towards the plantar aspect, that is plantar flexion. If you are moving the toes up, standing on the heels, this is known as dorsiflexion. So these are the movements of flexion versus extension. So let us see them on the different joints of the body. At shoulder joint, moving it forward is flexion, moving it backward is extension. At elbow joint, folding it is flexion, opening is extension. At hip joint, moving it front is flexion, moving it back is extension. At knee joint, you see, take a note of the decreasing angle, even if it is in the backward direction. This is flexion. The decreasing angle is considered in flexion. Then the same is for the trunk and the neck. If you bend forward, this is flexion of the neck. If you bend forward, this is flexion of your vertebral column. And same straightening up, moving to the back, this is extension of your neck and trunk. For the fingers, it's so simple. When you're folding it, it's flexion. When you're straightening them, this is extension. But for the thumb, it is a little tricky. You see, the thumb. Let me represent the other fingers as thumb. The thumb is not placed like this. Thumb has been rotated at the 90-degree, so its folding is at different angle. So as your fingers flex anteriorly, your thumb, as it has rotated 90-degree, you can just look at the nails. Its nail is placing in on the sideward direction, but your other nails are in the backward direction. So the thumb flexes in this direction. So this is the flexion of the thumb, this is the extension of the thumb, but this is the flexion of the fingers, this is the extension of the fingers. And then there is lateral flexion of the trunks and the vertebral column. This is the left lateral flexion of my neck. This is the right lateral flexion of my neck. This is the straightening or extension of my neck. Then the next pair is adduction versus abduction. Any movement that is away from the midline will be abduction. Like my arm, if I'm moving it like this is abduction. I'm it moving away from the midline. I'm bringing it back. This is adduction. That will be same for my lower limb. If I move my foot towards the side, that will be abduction. If I move it towards the midline, that will be adduction. For the hands and the toes, you define, it's very difficult to say because in the anatomical position, all the fingers have to go like this to be adducted, and all the fingers will have to go like this to be abducted. To avoid this confusion, in the hand, the midline is defined as the middle digit, like your big toe, your index finger, your middle finger. So this is the midline of the hand. So this is the midline of the hand. So all the fingers moving away from this midline will be abduction. All the fingers moving towards it will be adduction. Adduction, abduction, adduction. The same will be with the toes of the foot. In that you take the midline from the second toe. So this is the abduction and adduction of the shoulder joint. This is the abduction and adduction of the hip joint. Circumduction, a combination of these two, of all these four. If you move your shoulder anteriorly, flexion, you did flexion, you did abduction, you did extension, you did adduction. So this circular movement as a combination of flexion, abduction, extension, adduction, this circular movement, that cone-like movement that has at the point of movement there is a cone, there is peak of the cone, and then there is a base of the cone right here. This is known as circumduction. Rotation. You don't bend forward, you don't bend back, not sidewards. You rotate at the place, at the axis you are at. For example, for my head and neck, this is rotation. Rotating to the right, rotating to the left. For the shoulder joint, this was flexion, this was extension, this was abduction, this was adduction. You can place your hand right here and try rotating it like this. This bone is rotating like this on its axis. This is lateral rotation of the humerus at the shoulder joint. This is medial rotation at the joint. The same you can do with your hip joint. So the key is to look at the anterior surface. If anterior surface is going outwards, this is the lateral rotation, external rotation. If the lateral surface is going inside, that is the medial rotation or internal rotation. That will be true for the upper limb and the lower limb. Then comes the pronation and supination. As you can see your hand, you can place your hand like this and you can move it like this and this. So this is happening at the joints present here and here, superior radioulnar joint, inferior radioulnar joint. So this is moving anteriorly in the anatomical position, or the palm uh, facing superiorly, that is supinated position. This is pronated position. I'm lying prone, I am lying with my face down. So moving towards like this is pronation. Moving like this is supination. Pronation, supination. So you can remember it by superior for supination. When your palm is facing superior, you are moving it into the supinated position. You are doing supination. Opposition and reposition. We talked about thumb at the 90-degree angle with the rest of the fingers. You can do it like this. Thumb is not exactly fixed at 90-degree. It rotates to change its position. So this rotation is important when you touch the pad of little finger with your thumb. So this movement the thumb is doing, this movement is opposition. Getting it back into place, this is reposition. This is opposition, this is reposition. Inversion versus eversion of the foot. If you have ever worn a big heel and you have twisted your foot, you know very painfully what is inversion. When your foot twists in such a way that your plantar surface of the foot faces towards the midline, this is called inversion. This is called inversion. when your foot is twisted in a way that you are standing on the medial margin of the foot and the plantar surface is facing externally eversion. Plantar surface, sole of the foot is facing laterally eversion, sole of the foot is facing medially inversion. You can extend upon this theory by saying that if you are standing on the lateral margin of the foot, you are inverting, you are standing on the medial margin of the foot, you are everting. It's just the play of words. Moving any part of the body superiorly, this is elevation. This is elevation of shoulder. Moving any part inferiorly, that is depression of the shoulder joint. That can be for the jaw. I elevated my jaw and depressed my jaw. Move superiorly, move inferiorly. Protrusion versus retrusion. Moving of the structure anteriorly will be protrusion, protraction also it said, and moving it backwards it's called retraction. So if you talk about the jaw, this will be protrusion. Moving it back, retrusion. Shoulder joint, move forward, protrusion, backward, retraction. Moving forward, moving backwards. That's it. That's all the terms for the position and the movement. A lot of the positions picture from the Gray's Anatomy. You can pause the slide here and go through them, all of these arrows, to look at the position and movement terms. And here is that story again. I hope you can better understand it this time. You can pause the video and look at it. Thank you so much. That was the end of it. I hope it was beneficial for you. If you have any question and queries, please mention down in the comments and follow us. I will be continuing with the series of the general anatomy. See you next time.